All right, we're live.
Good evening and welcome, everybody. We'd like to welcome you to the COVID-19 recovery, listening to our community public forums. I'm Jennifer Kirkham and I'll be facilitating tonight's session. The City of Brantford recognizes that the COVID-19 pandemic has resulted in severe and unprecedented challenges in the lives of our community members, including but not limited to challenges concerning physical health, mental health, finances, and spirituality. Our goal of these public forums is to gain a better understanding of the specific supports needed to help our community endure and recover from the COVID-19 pandemic. Over the last 2 weeks, we've shared information about how community members can participate in these virtual public forums, including registering in advance to speak live, submitting feedback through the Brantford Let's Talk webpage, and watching the live streams on the City of Brantford's YouTube channel. City staff are joining me tonight and they will be capturing comments and questions that the speakers raise. And then at the conclusion of these 4 public forums, our next steps will be to report your ideas, concerns, and questions back to City Council in order to advocate on behalf of our community to the provincial and federal levels of government. We will also provide a summary of this information to the community. The City of Brantford welcomes open and honest communication. However, we uphold zero tolerance for hate speech, profanity, and other inappropriate language and conduct. Participants who engage in these behaviors will be removed from the meeting. And examples of inappropriate language and conduct include verbal assaults, threats, or attempts to intimidate, attempts to goad or incite violence in others, or racial, ethnic, religious, sexual, or gendered insults and slurs. You would have seen the questions that were developed to help guide our discussion today, but we're going to be focusing on 3 questions tonight. And tonight our main topic is physical health. And the 3 questions that we will be hearing from our speakers are: what did we do well as a community to support each other during the COVID-19 pandemic? What are the needs of the Brantford community as we move forward? And what can the municipal, provincial, and/or federal governments do to support pandemic recovery? All important questions as we think about moving forward. So I have a list of registered speakers for tonight, and I will call on you when it's your time to speak, and we'll unmute you so that you're able to speak. You'll each have up to 10 minutes for your comments and questions, and I will provide you with a 1-minute warning as you're getting close to the 10 minutes. So let's kick it off with our first speaker tonight. So I'd like to invite Peter Zota to join us this evening. Welcome, Peter.
Good evening, folks. Can you hear me okay?
Yes, we can hear you. That's great.
Well, thanks to the city for the invitation. I work in the Community Health Center, Grand River Community Health Center, and my main intent in being here is, quite frankly, it was more to be listening. Because as a representative from the healthcare system, we share all the city's goals, and your guiding questions are very relevant to us too. So my main reason is listening and engaging and hearing and trying to be the conduit for some of the issues to be forwarded back to the various forums with which I have regular interface. I'm involved in the Vaccine Task Force, in the Primary Care Council, in the Ontario Health Team development, and if there's a place for any of those groups to respond to any of the issues coming forward today, I might be able to help in that regard. I do have a couple messages and concerns that have come forward from the healthcare system. And one is about the tremendous amount of deferred and delayed care that has been an unintentional product of the pandemic. There is considerable concern that citizens, patients, clients are avoiding certain elements of the healthcare system, including their family physician or nurse practitioner. There's concern that diagnostic imaging tests volumes are way down, and people are avoiding pursuing diagnostic imaging, other diagnostic tests. There's been a dip in access to primary health care. There's been a dip in all sorts of preventative screening activities, especially for cancer. So my message from the Primary Care Council would generally be not to avoid primary health care from your family physician, nurse practitioner, health center, or what have you, because that too has tremendous consequences. And I would be remiss if I didn't put a plug in for encouraging all citizens to pursue their first and second vaccines. Some primary care offices, such as Grand River, are providing clinics, and our health unit's doing a tremendous job in providing vaccine clinics. And my final message would simply be one of encouraging folks to pursue vaccine. I'll leave it at that unless there's questions later that I might be able to help with.
Great, thanks, Peter, for some of your opening comments, and thanks for mentioning a potential sort of response from the community health center. That's very helpful as well. So I'm going to pass it over to our next speaker tonight, who is Winona. So Winona, welcome. Thanks for joining us tonight.
Thanks, Jen, for having me, and hello to everybody else on the call. A little bit of context about myself. My name is Winona, and I am the labor market analyst at the Workforce Planning Board of Grand Erie. So we're a workforce development organization that supports both Brantford and the surrounding communities of Brant, Haldimand, Norfolk, Six Nations, and New Credit. And like Peter, I did join to play a listening role and hear a lot of what the community was experiencing. But I do have some intel on some of the issues that I think are prevalent and will need to be addressed moving forward. So in terms of the needs of our community, I would definitely say that being cooped up has been challenging for a lot of people, and we've heard from several different sources, both locally and provincially, that mental health as a result of that has been impacted. And I know that this is specifically for physical health, but of course those two things are very closely connected. So things like being able to exercise or to be able to socialize with groups of people and meet new people, I think those are all important elements of how people rebuild their physical health moving forward. So I would say that needs to be prioritized, and I think the way in which we can prioritize that is through social programming, in terms of hosting more events at Harmony Square when we're able to, when things open up again, of course, as well as particularly focusing on specific groups that may have been even more neglected or may have suffered even dire consequences of the lockdown. And I'll point to children. Of course, socialization is a huge part of how they develop. So it'll be really important to help kids reintegrate in different ways, and things like summer camps or events at Harmony Square or the YMCA, places where children can get back up and running and socialize, I think will be really important in the months to come. And I would emphasize that really, really needs to be targeted towards people that are generally not able to access things like summer camps due to issues like income. So specifically people from lower income households. I would say some immigrants may fall into this category as well. So we really need to be prioritizing those specific groups as we respond and create programming that'll support them. And then I think on a broader scale, access to healthy food is a really, really important element of how we all recover. And of course, I think we all know that affordable food is becoming a growing concern for some people. So increasing the access and affordability of food and promoting issues around food security and locally grown food and how people can access that will, I think, help with the recovery moving forward. Those are my quick comments. Again, I'm really looking forward to hearing what others have to share, and where possible, if we can support that as the Workforce Planning Board of Grand Erie, we would like to be able to do that. Thanks.
Great. Thanks for joining us, Winona, and for your comments. Next, I'd like to welcome Ian to join us this evening.
Brilliant, thank you. My name is Ian Aiken. I'm the Executive Director at the Legal Clinic located in Brantford, Brant, Haldimand, Norfolk, Six Nations, and the Credit. I'm calling today, thank you first of all, calling today to speak about what we see as an upcoming flood or tsunami of evictions and homelessness in all of our communities. We're, as many of you may know, that during COVID, there's been a hold or a lack of the ability of people to be evicted because of lockdowns and provincial mandate. What we're seeing and what we're going to see over the next little while is, as I say, a tsunami of evictions and homelessness. We're dealing on a daily basis with clients who are being pushed out or forced out of even, quite honestly, unaffordable housing at this stage. COVID has had an incredible impact on or a decrease in the lack of affordable housing. Rents have skyrocketed in many cases. In fact, we've seen in the Expositor recently an article about clients trying to find housing and actual bidding wars over apartments. We're seeing a lot of smaller landlords who may own duplexes, triplexes, smaller apartment buildings, because of the ability to sell property at an increasing rate, selling properties. And what is happening is properties are being sold to local investors or even people just trying to find a residence and buy a residence. And what is happening is that is inflating the price of units, of apartments. And in fact, we're seeing more and more and more people being evicted because new owners are buying units and having them, quite often legally, of course, but having them evicted because of own use provisions or rent evictions, et cetera, et cetera. And it's really, affordable housing, or the access to affordable and subsidized housing, has been a crisis for quite a while. I acknowledge that the city, and in particular this council, has taken steps, and really proactive steps, to try to increase affordable and subsidized housing. But quite bluntly, it's not going to be enough. Let me give you an example. We have discussions. Just yesterday, I had a discussion with a senior who's been renting an apartment for, I believe, 13 years, a small one-bedroom. The cost over the last number of years has been about $800 plus utilities. Somebody has purchased that property, and she is going to be forced to leave in approximately 3 months. And with her income of approximately $1,500 a month, she is not going to be able to find an apartment in the private rental market. She's been looking, and she's looking at small one-bedroom units that are priced at the range of $1,300, $1,400, and $1,500, which would take up all of her monthly income. So daily, we're dealing with clients who are faced with eviction. They aren't able to stay with friends, family, because things are so jammed up. The waiting list for social housing has been for quite a while, has been years long. That waiting list is growing exponentially. We have clients who are trying to access shelter beds and there are no available shelter beds. They're effectively faced with a situation where there are no actual housing options for them. And we're talking to people who are not able to access housing, even if they are working full time, even if they've lived in apartments for years and years and years. There's simply the market has exploded in terms of rents. So we see this. We're starting to see bits of this kind of in our community. Unfortunately, it's going to explode. The immediate issue is people finding access to shelter beds. What we need from the provincial, municipal, and federal governments is a three-pronged attack. Immediately, we need access for tenants to, if they need it, to have access to shelter beds. And if that means access to and payment for motels for extended periods, we need that to prevent many people from being homeless. There has to be immediately a rent supplement program put in place to allow people to transition into a situation where with their current income and rent supplements, they're able to at least find something in the private market. And as I noted, there has to be aggressive, as the local council has done, but even more aggressive action taken to build not only more affordable housing, but more subsidized housing. If we don't take immediate action on this, we're going to be quite honestly overwhelmed with people who are struggling even to find a roof over their head. None of this is good news, but I thank you for your time.
Thanks for your comments, Ian, and for joining us tonight. Next, I would like to welcome Melissa.
Hi there. Can everybody hear me?
Yes, we can hear you.
Wonderful. First, I'm going to apologize for my unpreparedness. Normally, I have a fully prepared document to be able to share with you. But we had an unexpected incident that occurred, and we actually had a client pass away this weekend, which is something that I've been given permission by the family to share with you because it directly reflects what we're talking about this evening. I am from Guiding Hands Coordinated Services. I work with individuals with developmental disabilities who also struggle with mental health and addictions issues, many of them. Probably about 15% of my caseload is also homeless. They receive funding called passport funding under Developmental Services Ontario. This funding is supposed to be utilized to support them in their recreation goals and to access the community. But the majority of the individuals that I work with actually end up using that funding through us to support their emergency needs the majority of the time currently. Because one, right now, because of everything that's happened with COVID, but also because of the dire situations that they're facing because of their extreme poverty and the situations that they face residing in our community, because of homelessness, because of their mental health and addictions issues, and the fact that they are marginalized. So I'd like to start by talking about my concerns regarding hospital care and how difficult it is for individuals with mental health issues seeking care within our hospital system when they go into our emergency system, because there doesn't seem to be enough understanding of our mental health community, particularly if they also come duly diagnosed with a developmental delay, and how to work with those individuals or how to support them. And one of the difficulties that we had at the start of the pandemic, particularly in that first lockdown, was the fact that none of these individuals were allowed to bring a support staff with them. So when you have an individual with a significant mental health issue and they cannot bring their support person with them, that created a significant amount of chaos and sometimes resulted in them refusing to seek treatment because they didn't have an advocate. They didn't have somebody to help them navigate that system or to even feel safe. And oftentimes walking into the hospital, they didn't feel heard, they didn't feel respected, they didn't feel like they were going to get the treatment that they needed. Additionally, when I was young, if somebody had had too much to drink, you could take them to the hospital. They would spend the night in the drunk tank. The hospital wouldn't let them leave until they were certain that they were no longer going to be a harm to themselves. I've taken individuals in the last few months that openly admitted that they had done meth, that were begging for help, that weren't sure if they were going to survive. They were terrified, these individuals. And I've had nurses openly look at me and say, "What would you like us to do with them?" They've been here 3 times this week. I understand that sometimes these individuals are choosing to use. That's what an addiction is. We need better understanding of addiction. We need people who understand how to treat addiction within our ER system. We need compassion in the people that are treating them. We need a system that's willing to work with that, because right now we have an epidemic in our city. We have people that are facing addictions and mental health, and we need to figure out how to help them deal with that. And the frightening piece is, across the developmental sector, we're seeing a growing situation. We are seeing a situation where the dealers have learned that they can target this vulnerable sector. This sector of individuals who don't know how to say no, who don't know how to protect themselves. They've been targeted by the dealers because they want to fit in. So we end up with a situation where here are people with a guaranteed income every month of ODSP. So they know exactly what day to find them because they know they'll have money that day. They know what words to use with them. They know how to push them to get them to agree to try out these things, and then they have a new addict. And our guys are vulnerable. They don't know how to say no. They don't know how to seek help afterwards. They don't have the means to want to succeed after they've become addicted to something. So it takes a different kind of help to be able to help them. And we need specialized training to be able to help them succeed in that area. So that would be issue number 1 that I want to talk about. Issue number 2 would be the access to the vaccines that are out there. Initially, accessing them was difficult and complicated for our folks. We were being told by the province that individuals with disabilities were going to be prioritized, and yet here in Brantford, we weren't able to figure out how to make that happen unless they were connected to one of the larger agencies. It took a long time before they were able to get their vaccinations for some of them, because not all of them are connected to, for example, a community living. And that's just the nature of how individualized funding has caused things to go. We had individuals that required a level of support that meant that they couldn't wear a mask, so they couldn't attend the vaccination center. And we didn't yet have a system, and I don't know if we still at this point have a system where we are able to send people out to provide those vaccinations in home. So we need to get to a point where we can do that, because we have some individuals that are severely challenged and are not able to get out to the vaccination centers to get their vaccines. Or if they're behavioral, how are we handling that? Because we've had people that were not able to get their vaccination as soon as the health unit heard the word behavioral, because they're afraid that there might be an assault. And while we understand that, we still need to get those people vaccinated. So vaccinations are a concern. Additionally, we have a huge concern about the lack of in-person support. One of the reasons that people are not able to seek medical care is sometimes they require in-person support to be able to do so. And there is an extreme shortage of support workers right now. Normally, I would have a team of 12 to 14 people. Right now, I have a team of 3. There just aren't support workers out there. The support workers are few and far between. I understand that the government is looking at pushing a training protocol that's going to hopefully speed things up, but I also know that they're likely focusing on personal support workers. We need an addition of a huge number of well-trained support workers, and I'm concerned that if they start rushing that training, that those support workers may not come out being the kind of quality support workers that we need, that are going to be good at what they do. We need them now, but we need them to be good, because if we don't have quality workers, then we end up with people getting hurt. We end up with people not getting the care that they need. We end up with a worse situation than what we started with. We also have a number of families that have been approved for support through the LHIN, or now called Home and Community Support Services. So this is home care hours where people are supposed to be able to receive support from a nurse or support worker that comes into their home to provide support to their individual, whether it's bathing or personal care needs, because the family is not able to do that themselves. And those hours are not being received anywhere near the level that they have actually been approved at, because there are not the workers to provide it. So I have families that are supposed to be receiving this care 7 days a week. They're lucky if they see a worker 2 or 3 days a week. Oftentimes those workers, when they do come in, are attached to their cell phones, are not paying attention to what's happening with the individual. Families are not feeling comfortable with the level of care they're receiving. If the family files a complaint, they then don't see a worker for 3-4 days. And that's extremely concerning. Families are being encouraged to say that they no longer require the support that they're receiving. And these are reports that I'm receiving from those families, that they've received a phone call and were asked, do they still need the support? Are they sure they still need the support? You know, they've been a while without the hours. They must not actually need them. Maybe they can use their passport dollars to do that support instead. It's very concerning when we're pushing people to continue to hide in their homes and not receive the support that they actually need. These are aging families. These are parents in their 80s that have been caring for their children. What happens when those parents pass away and there's nobody to care for that child, that person with a disability anymore? What happens? Because there are no other supports for them anymore. The wait lists are a mile long. Who's going to care for those people then? Sorry, that's all I have. I don't know if you folks have any questions for me, because I normally have a much fuller presentation and more information.
Thanks, Melissa. I appreciate you providing us with your comments and providing some of the real life experience that you shared with us tonight. We have one more speaker tonight. I'm going to welcome Terry to join us.
Can you hear me okay?
Yes, I can hear you. Thanks, Terry.
Good. Thank you very much for what looks like a very excellent format that you've developed, and for the opportunity to be able to speak. I want to introduce my more substantive comments with some introductory comments. I'm no longer a Brantford citizen. I lived in Brantford for 30 years. I have family and friends there, and I've always tracked pretty closely what was happening there. By way of background, my presentation tonight will be based on an element of the pandemic equation, which not too many people have come to realization exists, let alone will raise some pretty substantive comments or problems over time. And it relates specifically to the science of the total environment, the physical impacts of COVID-19 on the total environment. By way of background, I'm not a medical doctor. I'm an environmental scientist with a master's degree from Guelph and a doctorate from University of Waterloo. And in my previous reincarnation, I worked as a senior research scientist for Environment Canada for 32 years, and more recently as a research scientist at McGill and Concordia University. Having said this, you need to know that I've spent the last 15 months working for a client in Ottawa, looking at the more substantive environmental dimensions of COVID-19 and its variants, and how they're likely to have been addressed and or manifested across the Canadian environment. And I've also looked at over 100 of the 220 different countries that have declared the presence of COVID-19, and to the degree in which these effects have become manifested and or are being addressed in the context of more substantive science, environmental science issues related to virology and cell biology and ecological engineering and epidemiologically in the broader environmental science area. So what I've done after having done that is collapse this research work into 5 areas or 5 specific needs with respect that I think the City of Ottawa needs to look like in the context of responding to the substantive issues associated with that COVID-19 up and above those public health ones that they've already addressed. The first one relates to more substantive information on pandemic waste-generated materials. We're burning through millions of face masks and rubber gloves and PPE materials on a daily basis. Most of them in theory are described as being disposable. In actual fact, they're not. They're not recyclable. They're made almost exclusively of plastic products that really cannot be readily degraded, and more likely are likely to fragment into smaller plastic particles and end up in the ambient environment. More concerns associated with this than with plastic bags, because these disposable masks end up in the environment, freshwater systems and oceans, and where when they're exposed to weathering, they can generate large quantities of these micro-sized particles during a relatively short period of time. And there's concerns now associated with these masks that they may break down into these what are referred to as microfibers, which more readily are immobilized in the environment and cause all sorts of problems. Also, the masks that you see laying on the ground raise some very interesting questions from a medical perspective, in as much as that there's no evidence to support that not only COVID-19 viruses, but other viral and bacterial particles may survive up to 3 days on these, and subsequently may raise broad impacts to ecosystems and organisms that they're associated with. Not an awful lot of work's being done on renewable alternative sources to these, so it's something to consider as we start moving into the cleanup and restoration side of the equation. The second area I wanted to talk to you about was an area it's pretty interesting to me. It's the information on COVID-19 effects for animal and wildlife health and for welfare. We haven't quite determined yet, and we're still waiting as a scientific community, as to the actual unequivocal source for the COVID-19 virus, whether it was man-made or whether it evolved from wet market, which referred to animal host. So we need to know better the source of these materials, because if you don't know where it's coming from, you don't know what vectors you need to address and better prepare for. We know now through some analysis that geneticists have done that there's many animal species that may be vulnerable to COVID infections. So humans are not the only ones facing these threats. It's no surprise given the historical role that animals have played. You look back at SARS, you look back at MERS in terms of human impacts. And more recently, we've seen evidence across Canada of animal health effects, significant animal health effects occurring in areas where there's zoos and aquariums, which have been unable to continue operations or operating at reduced capacity. Also seeing evidence of increased poaching of animals because of the non-compliance and non-monitoring by the regulatory community. And more interesting, we've seen very interesting work evolving out to the China, looking for the evolution of whether we need COVID-19 vaccines for pets, something we need to watch over time. The third area I submit to you is something is a need is the impacts of COVID-19 on municipal waste systems, What we've seen since over the last 15 months is that many Canadians have been living out of a box, whether that was on Amazon or Skip the Dishes or FedEx or Purolite or Wayfair. And this phenomenon has been augmented by significant quantities of organic waste foods and building materials and home renovations. Sorry. During the lockdown, many people have been ordering more food and deliveries and pickup, which means increasing amounts of disposable meal containers are being used. The net result of these activities has been a significant increase of waste delivered to and contributing to log jams at municipal dumps for treatment and disposal. And many of the recycling facilities across North America have shut down in the interim because of the pandemic, due to public health concerns. And also many municipalities have rescinded their plastic bag regulations requirements to allow for an orderly flow of consumable products. The fourth area relates to one which not too many people have been looking at in the broader public health community, and it relates to the impacts of increased disinfection byproducts in the water and in air for that matter, resulting from intensified disinfection during COVID-19 pandemics. So justifiably so, we've seen an explosion of corona pandemic virus cleanup techniques involving a variety of different disinfectants, some of which are benzene-based, which are carcinogenic, some of which are ammonia-based, which cause all sorts of problems, and some which are chlorine-based, which would cause all sorts of problems. There's no guidelines out there in terms of how these disinfectants should be used or possibly could be used. And more importantly, there's been no follow-up as to what the long-term and midterm effects might be of the significant use of those disinfectants, and probably an anticipated increase in use of those over time as we work our way through the pandemic. And that relates to effects on water, drinking water, and wastewater, groundwater. And also we're starting to see evidence, so interesting enough, of the presence of disinfectants in the air and the concerns that it's raising in terms of the exposure to aerosols. Okay, now having said that, and thank you for your patience so far, there's 5 areas that I've more or less identified that the City of Brantford may want to give some consideration to as a strategy starts to unfold. It's not unrealistic to expect, since the World Health Organization declared this pandemic, that smart collective action we should be pursuing right now to prevent this from happening again. I think that the Brantford City Fathers and employees need to start preparing themselves and fully integrate themselves into evolving post-pandemic actions at the Federation of Canadian Municipalities, Canadian Council of Ministers of the Environment, and other national organizations that begin to organize national strategies for addressing some of these more substantive environmental considerations. The Brantford Area Conservation Authorities need to start looking at collaboration amongst and between themselves and the other 35 provincial agencies around Ontario, and addressing a pretty significant infrastructure consequences from the overuse of these facilities. I don't know if you've been out to any of these conservation authorities over the last few weeks and months, but they've really been taking a pounding since pandemic reared its ugly head. And we're seeing evidence now of an anticipated increase of bookings in Ontario parks, 110% over last year, so it's not going to go away. Transportation systems need to be improved in terms of the disinfection approaches, and as a priority to encourage increased ridership and new ridership. I know in the City of Ottawa, the reluctance to use a transportation system for a variety of reasons has resulted in an estimated $1 million a week loss in revenue. We need to start looking at reusable and recyclable forms of personal protective equipment, masks, gloves, gowns particularly. And finally, there's some very interesting work being done just up the road from you guys at Massey University on developing a very positive and accurate detection, monitoring, and surveillance tools for detecting the presence of COVID-19 viruses and other virus particles in wastewater. And what's really neat about this particular technique is that you can detect the presence of the actual virus particles up to 2 weeks before it actually rears its ugly head in the form of manifestations in the broader population. And you can also determine what areas within the city are the hotspots, I guess, if you will. So something to think about, which could be built upon on existing technology and research work being done by academics and in close proximity to you guys. I'll end there, and I'll thank you very much for your time and your consideration, and I'd be pleased to respond to any questions you might have.
Great. Thanks for your comments, Terry. We do still have a bit of time, so I'm going to ask if any of our speakers would like to come back and respond to any comments or questions. If you do, just please raise your hand. Peter, go ahead.
Sorry, do you hear me okay?
Yes, I can hear you.
Sorry, I'm just going back to Linda's comments. So many of her observations resonated with me. And I mean, I could say that so much, especially in the home care capacity, does relate to simply worker shortage. But there were other pieces of the comments that I think that a more imminent remedy might be there, especially around home vaccines. I think that has started, and the community paramedics are doing something in that regard. And I'd gladly raise that at a vaccine task force meeting that's scheduled tomorrow morning. And I'd welcome Laura if you could connect me offline with Linda, and we'd continue the conversation.
Great, thanks, Peter. Any other questions or comments people would like to make? If you would, I'm going to ask you to raise your hand so I know that you'd like to speak, because I can't see you visually. Ian, did you want to add something?
Oh, thank you. I just wanted to thank, and I thought it was Melissa, but perhaps it was Linda.
No, it's Melissa. Yeah.
Melissa, very powerful presentation, and I want to send my regards to the person that has been lost to us and their family. If there's anything we can do at the clinic to help out, you know, we do lots of landlord and tenant and ODSP work. I'd be happy to chat with you. So thank you for that presentation. It's very powerful.
Thanks, Ian. Any other comments people would like to make after hearing the speakers? I'm not seeing anything, so I'm going to move into a wrap up. So I want to thank everybody for taking the time tonight and coming to chat with us about physical health and some of your thoughts about sort of impacts of the pandemic. Some of you made some suggestions around where we could be going from here. So thanks for taking the time to share your ideas, concerns, and questions with us this evening. If there's any other information that you would like to share, or people watching us live on YouTube would like to share, please visit the Let's Talk Brantford COVID-19 recovery webpage to have your voice heard, so you can share some further thoughts or ideas that you have there. All of the information shared with us tonight will inform a series of reports that will go back to City Council to support the ability of Council to advocate on the community's behalf to the provincial and federal governments. And a summary of these reports will also be made available publicly if you would like to access them and see what's in them. You'll also see going through the screens right now a number of resources. So just to remind you, there are a number of health and social support resources available to you in your community, and you'll see those going across your screen. So please feel free to reach out or share those resources if you do have any concerns about physical health or any of the other topics that came up this evening. So again, once again, thanks for your time. Thank you to the speakers who came and shared with us this evening and taking your time to do that. We appreciate it very much, and I hope you all have a great night. If you would like to join us, we do have other sessions, so make sure you take a look on the City of Brantford website for the 3 further sessions and public forums that we have on the other topics of mental health, finances, and spirituality. So maybe we'll see you on another night. Thanks again, everybody.